I want to highlight some of the characteristics of research and how some of the work you've already done with the CHIP process, kind of how we could almost transition that into a framework of research through just a few little changes. Talk about the phases of research transition, provide a little framework for the levels of community engagement so that as you guys start engaging with academics, you kind of have an idea of where you'd like to be in that partnership and how you'd like to share information and collaborate with the academic partners. And then just give an overview of our Chip to Chirp training, so really to highlight how we've structured some of these curricular elements to really map onto the research project. So what we heard, I know some of you just participated in the intake surveys this morning, but we really heard two things, and that's that people were interested in skill development. They wanted to know really, how do you do research on humans? They might have heard about how you do research on animals, but how do we collect information in our population level? Or some of you who work, for example, in public health or other agencies, you might have programs, and so people had questions. One person said, you know, I do outreach in the Latino community and I don't know what goes on behind the scenes to develop programs through research. I'd like to learn more. So people thought this was a real opportunity to build skills. We also heard strongly that people want to do things that can impact and benefit the community, and they really see research as one of the ways that your efforts can have a strong impact on the community and that you can evaluate what that impact is. So research is really valuable. This is a cartoon that this says, then a miracle occurs. It's talking about the process and developing the equation, and the professor saying, I think you should be more explicit here in step 2. So part of what often happens is we might have programs that we do in our communities, but we might not actually know what the active element is that makes a program effective, or we might not collect data that allows us to say, you know, this is the real active reason why, say, we were able to improve physical activity, or we were able to increase awareness or performance of certain health behaviors. And so research really gives us a framework and a process to start asking some questions about things we often engage in our daily lives, but in a systematic approach, so that we can really say, it's not just a miracle, but this is one of the reasons why. The thing I just wanted to point out is that we can pretty much address almost any question through research. You could look at how do you punish your child, or what's valuable. You could look at sleep disorders and academic performance. We can look at chronic pain and depression, you know, which comes first, or are they co-occurring, you know, do they actually influence each other? We can look at dog ownership, health and physical activity, you know, so there are all kinds of questions you can look at through research. We can look at childhood obesity and how do we make policies that actually help us reduce this epidemic before it becomes prevalent in people's lives. So is the CHIP assessment research? So how many of you have helped out with the baseline CHIP assessment, where you guys do interviews in the community and you look at data on your kind of current health context here? Great. So what Beth has described is really what we call in the academic community a mixed methods approach, which is where you use qualitative data, which are the stories or the interviews that you guys actually participated in this morning, and you also use numbers or quantitative data, and you really look at the complementary nature and what each of those can tell you about the local context. So the CHIP assessment is really a process, you know, and it's a process to understand what's going on in your local community and what you want to tackle. And it's very similar to what we do in research, but research adds a little bit more structure and rigor and a very clear kind of protocol and set of processes that you're going to adhere to at front, as well as how you're going to analyze and report that data out. Okay? And so we'll talk a little bit more about how we can transition kind of this community health assessments that we do frequently, how you can add the research lens to kind of just make the scientific rigor behind those approaches a little bit more concrete. So what is research? So Webster, you know, he says the dictionary, investigation or experimentation aimed at the discovery and interpretation of facts, revisions of accepted theories or laws in light of new facts, or practical application of such new or revised laws or theories. Or the Federal Regulations Code that really specifies how we go about research and what steps need to be in place and what processes and what the rules are around research. You know, it's a systematic investigation. We're testing things and we're trying to develop generalizable knowledge. So we're trying to collect information here at the local level or at the local context in a way that allows us to hopefully scale up some of what we're doing to other areas, or so that they can use the approach we use to actually address similar issues in their community. So characteristics of research, the CHIP assessment is, kind of a foundational start to how we might do research. But research really, you look at making it systematic, formalized, and really having an explicit process. So you have generally a protocol that you're going to go through, and you have an institutional review board that actually approves that protocol and makes sure that the benefits of participating in conducting this research outweigh the risks. And so they do a concrete review, and we actually will talk more about that and what they're looking for and why, because there's actually been a history of kind of exploitation of some underserved populations through research. Okay, so we want to make sure that doesn't happen. There's a process where you state assumptions, you develop the plan to study, you collect data, you analyze it, and you disseminate it. So you share it either in academic publications or in newspapers or in ways that you think are important to raise awareness about what you discovered. Research has clearly defined concepts, it's systematic. You use instruments and measurements that ideally have been developed through a process, okay? So you don't always just create a questionnaire, you don't just write your questions down and then administer them to people. Ideally what you do is you find questions that have already been developed and validated and shown to be effective in other situations, and you try and use those in your own setting, or you try and modify them slightly through a process for use in your own setting. And then reporting results. So we all see the world, right, from our own lens. And one of the keys that research really tries to do is to give us a framework so that some of our personal biases, they aren't necessarily pushed out onto others, that we use a process that allows us to really see what the data and what the true circumstances are. So I think Paul has maybe talked a little bit about the phases of research, but there's something called kind of stages. And so you think about bench research, and so this is research generally on rats or in the lab. You think of kind of their scientists at their bench, maybe testing a new drug on rats, or you might think of looking at how cancer cells divide, okay? And then you think about moving from bench to bedside. They call this translation 1 or T1. So bedside is actually taking information, so taking medications and trying to test them on humans to see what the effectiveness is, okay? And then once we know that something, so let's say we have a new diabetes medication and we know it's more effective than previous medications were. The next step is, well, how do we actually get that out into practice? And so T2 is really the developing of guidelines or systematic reviews, so looking at the literature and really saying, this is the best approach for treating a patient. When we get into T3 and T4, that's really, how do we get this information about best practices out into the community? So let's say that there's a certain approach for teaching or education that's been really demonstrated to be effective in these controlled environments. How do we actually get them out into Madras or Prineville schools? How do we actually make this practical in the real world? And they really call that translation and dissemination research. And the thing that's really important about translation and dissemination research is that, the context in a rural area is very different than the context in an urban area. And what you really need to think about is, how can we maintain what they've discovered to be effective about these interventions or about these treatments? But how do we also tailor them so that they're appropriate in our current environment and our current context, given who the players are and what things look like? So I just wanted to introduce a few key terms. And so when we think about research, we often start with a research question. So you might start with something like, well, how do school-based gardens influence, child awareness of nutrition and health behaviors? And then what you would do is you would actually refine that research question and state it as a study aim. So you would say, we want to evaluate the impact of participation in a 6-month school garden program on child nutrition habits and interest in consuming new foods as compared to similar peers who did not participate. Okay, so you take your research question, we want to know about this, and we state it in the terms of, we're going to investigate, or we're going to aim to accomplish this goal in our study. And what you might do is you might actually state a few hypotheses. So you might state something like, you think children who participate in the school-based program might be more likely to choose nutritious foods, or they might be more likely to actually be willing to try new foods. And so you really use this process of thinking about the research question, looking at the literature to actually see what's out there, what's come before, to figure out what's the new question you need to ask. Okay? So one of the key things about research is you never have to start from scratch, right? So what you can do is you can see what's come before, and you can see, well, how can the question we ask really build on the knowledge that's already out there? How can we push the field forward through our question? The other thing is study team members, and this was in your pre-assessment, I think. So one of the things is there's a principal investigator on each project, and this is really the person who is generally they write the grant, they have ultimate authority for how the process unfolds, for the quality of the data that's collected. They're responsible for making sure that we have proper institutional review board approval, and that the approach that's being used is appropriate, and that the protocol is being upheld. You also have co-investigators, so these are other team members that help out, a project manager who's kind of the overall coordinator generally for a project, and then you can have research assistants and a statistician. So in most studies, you generally want to try and get input from a statistician to make sure that you're getting information from the right number of folks, and that you're looking at the right factors that might influence the question that you're asking, that you're controlling for those factors. And I think the key question is, where do community partners fit in? These are kind of some traditional terms, but how do we work with community partners in this process? And the answer is that, community partners can be involved at all levels. And really, the question is, how do we help facilitate this type of collaboration? I didn't put statistician because I still go and get help from a statistician. So if you guys are experts, I'm going to start coming to you. So. The other thing I want to talk about is as you're starting to engage in this process of collaboration, one of the things that you might want to think about is, there are different levels at which communities can be engaged in research, okay? So in some cases, you might have people who come out and they might administer surveys in your community, they might collect data, but you might not actually have had a role in determining what the questions were or how that data was collected. You can have kind of lower medium levels of activity, which is like getting a focus group together at the start of a study so we can figure out, well, what's the question that needs to be addressed? What's the important framework that needs to be asked? You can have communities help actually implement a study that was designed by a researcher. So let's say we want to test a new medication. How do we actually get people who are real people in the real world to utilize this? Or you can have a really high level of participation and collaboration in research, which is kind of the framework behind community-based participatory research. And that's the idea that you're really, as a community member, an equal collaborator with the academic partners across all phases of the research process. And I think there are actually benefits and maybe challenges to each level of this kind of phase of research collaboration. But I think the question is just, as we move forward, how would you like to participate in research? So in your perspective, just to think about how you'd like to be a collaborator, how you'd like to partner, and to recognize that there are differences. And one of the reasons there are differences is that some populations have been exploited by research, and so there's this quote, outside researchers swooped down from the sky, swarmed all over, asked nosy questions, and then disappeared, never to be heard of again. Okay, so really the chip to chirp process is about building an equitable collaboration. So we both solve problems in the communities through the traditional kind of chip activities, but we also look at ways that we can address novel and new questions through the research process. So Paul talks about having a new model of drive-by research, which is actually where you guys are able to come by the university and shop for your academic partner that you want to collaborate with. And I think this is maybe a figure some of you have seen. It's one that you can't actually probably see, but it's basically a comparison of this community-based participatory research, which is really a collaborative approach to research compared to traditional research. And what it really emphasizes is that community partners should be engaged ideally in this model in all phases of the research process, from identifying the question to figuring out how do you approach the question, to even looking at the data and saying, this is what the data means, to figuring out how you're going to share the data. It's a great question. So community engaged research is kind of a generic term for academics collaborating with communities on a research project. And that's where in community engaged research there's those levels. You know, it can be a low level of collaboration where an academic might come out and collect data, to a higher level of collaboration, which is really where there has been a relationship that's been developed, and there has been kind of a co-creation of what the research question is and what the approach is. And so people would say community-based participatory research has important characteristics that really highlight kind of this equitable sharing of power, the role of the community in the process, kind of that individuals are involved all along the way. So I would say CBPR is one dimension of community engaged research if you think about it like that. Is that helpful? So with community engaged research, you know, it requires trust building, building a language for both the academic and community partners, and then recognizing this complementary expertise between the two partners, and then strategizing so that both individuals can have their needs met, you know, so that you guys benefit from kind of the expertise of the scientific community, but the scientific community also benefits because you guys know about what works and how the lay of the local land is, as well as what the important questions are for your local context. So the cool thing about community engaged research and Paul's chip to chirp process is that we can look at what the issues are on many levels in the community, and then we can think about addressing them through various different sectors. And so this is a figure that really talks about, you know, the CHIP assessment is the health issues identified by the community. So in this chip to chirp process, we're going to be looking at childhood obesity, I believe, and ways of starting to ask questions about how we improve childhood obesity. But you could actually tackle it at the clinic and hospital level, public health department, or at the community setting. And there are various ways that we deliver services to these types of individuals. And then this here is the types of research that we could use in each of these different sectors. So there are various types of research. I'm just going to highlight a few, and then David's actually going to talk more about some of the methods we use. But comparative effectiveness is this idea of looking at different ways of addressing something. So let's say we have two types of diabetes medications. And what we want to do is, in a clinic setting, we actually want to see which of these is most effective. You know, maybe there's one that you have to take only one time a month. Maybe there's one that you have to take 2 times each day. And so it's really pitting two different ways of treating the same condition against each other to see which is the best in this local context. You can do surveillance, so we could see, you know, at Warm Springs, what is the actual prevalence of diabetes? And how does this relate to maybe the physical environment, or to weight status, or characteristics like that? So surveillance is really getting a picture of the lay of the land and what the levels of the conditions are. We can do evaluation research. So in the schools, we can maybe introduce a plan to look at how do we improve access to foods for these underserved children or children who have food scarcity, and we can evaluate that plan to see if it's actually been effective. We can also do implementation research. So let's say that Lebanon, they have a pretty cool farm-to-school program, and what we could do is we could see, well, can we replicate that, or can we actually find ways to introduce that program here into our community in Madras? And so, as I mentioned at the start, the chip to chirp is really going to give you just enough information to really be dangerous. That's actually really what a PhD does, is it gives you enough information to start engaging in the research process and really start to think critically about kind of the world around you and how we can scientifically ask questions about the world around us. And so we have a process that starts with identifying this research question, and we'll do this through a series of ongoing activities that Paul will do, looking at developing a pilot partnership and then doing academic outreach. So how do we get academic partners who can help us refine that research question and design the study that we need to answer it? We'll do that refining through this Beyond Google. So Todd Hannon from the library is going to come out, and he is just going to help us figure out, how do you actually search for information besides just going into Google and saying, tell me about obesity, or what works, you know? And so he's going to talk about using academic search engines. We'll talk about getting grants. There'll be a panel selecting research methods, so David's going to talk about that today. We'll talk a little bit about the IRB, so history repeating. Why does the IRB exist, and what do you have to do to get IRB approval in order to actually collect data and do a study? We'll actually do a research study, so we'll talk about how you implement a project, and we'll actually, Beth Ann's an expert here, I think, by now, so we'll rely on you a lot for this. We'll talk about analyzing the data, so you might have seen p-values and confidence intervals and things like that, or how do you actually know that a study somebody has done has been effective? How do we look at that information that's presented in research papers? And then we'll strategize about ways to disseminate the findings, hopefully through both maybe academic means, but also at the community level. How do we improve and raise awareness about the important work you guys are doing?